Now to a tough topic, but one we feel we need to address here at Fox 13. Suicide and its prevalence among teens. In 2019, suicide was the #1 cause of death for our youth that are 10 to 17 years old here in Utah. Amy Nay has more on that and what we can all do when it comes to prevention in this week's Healthier Together report.
Faith Dickinson, behavioral health manager with Regents, says mental health, substance use, bullying, and the increased use of social media are all possible factors.
Youth with a lack of access to care are also at a higher risk, whether that is geographic, financial, or due to other barriers such as stigma. And honestly, the teen years are a stressful time filled with major physical and emotional changes that can cause feelings of confusion, fear, and doubt.
And add in isolation due to the ongoing pandemic. Nationwide, data on teen suicide deaths is still being collected for 2020, but the CDC reported a 31% increase in mental health-related ER visits, including suicide attempts, in 2020 compared to 2019. Experts say talk about it with teens.
Asking someone directly about suicide will not increase the risk or plant the idea. It will create the opportunity to offer support and let them know you care enough to ask.
She says offer a listening ear without judgment, watching out for these signs: lost interest in normal activities, withdrawal from family and friends, acting out behaviors, alcohol or drug use, problems focusing or speaking about death and dying.
It's so important for parents, teachers, and other adults to have more conversations about mental health and mental well-being with your teens.
Teaching your kids that it's okay to need help and that they're not alone.
Many people have and are experiencing similar feelings. Remind them that there is help out there.
Like counseling and behavioral health treatment, you can also reach out to the Suicide Prevention Hotline, not only in a crisis, but for access to other resources. It's 1-800-273-TALK. For Healthier Together, Amy Nay, Fox 13 News, Utah.
If you or someone you know is experiencing suicidal thoughts, there is help available. As Amy mentioned, the National Suicide Prevention Lifeline is 800-273-TALK. That's 800-273-8255. It's free. It's open 24 hours a day, 7 days a week. You can also text HOME to 741-741 for help anytime.